Anna is 23 years old and currently 8 months pregnant. She and her mother, Maya, are visiting a clinic today to learn more about the possibility of breastfeeding with HIV. Anna's mother is adamant about her daughter breastfeeding despite the risk of transmitting HIV to the baby. Anna is willing to discuss her options.
Hi, my name is Kathy. I'm going to be a nurse today. What are your names?
I'm Anna.
I'm Maya.
Nice to meet you. So what brings you in here today?
I'm 8 months pregnant and I'm worried about breastfeeding. I have HIV and I don't want my baby to have it too, but I really want to breastfeed because I feel like as a mom I should. I'm taking my antiretrovirals, so it should be fine, right?
Everyone in our community breastfeeds. Imagine what they'll say if you bottle feed. Don't you dare shame me, Anna.
I understand your concerns. Could the two of you tell me more about your family and community?
Well, I live with my mom and my baby's dad, but he's not really into the baby stuff. We live in a community where everyone breastfeeds, and if you don't, then there must be something wrong with you. No one knows I have HIV though.
I will do anything to get her breastfeeding. Money is not an issue.
From what I'm hearing, you seem to be financially stable. There does seem to be some conflicting views between the two of you, but I think we can work together to find a balance. I think it's a very big step that the two of you are even in here together today. If you're finding that there's a lack of support from your community, we can always connect you to other support groups with moms going through similar situations.
What's the chance my baby gets HIV even if I do breastfeed?
So there's about a 9 to 16% chance that you'll transmit HIV to your baby if you breastfeed, but since you're taking the antiretrovirals, that goes down to about 1 to 2%.
1 to 2%? That's still something. What am I gonna do if I can't breastfeed?
Well, if you're interested, I can refer you to a lactation consultant. They're more highly trained in this area, so they'll be able to answer your questions better.
Okay, let's do that.
Sure, I'll give her a call. Hi Ashley, this is Anna. She's 8 months pregnant and she's HIV positive, and she was just wondering about some alternative options to breastfeeding.
Sure, I can help with that. Hello Anna, I'm Ashley. I'm the lactation consultant here. So for HIV positive moms in Canada, the Public Health Agency recommends exclusive formula feeding for 1 year after birth.
But when I googled it, they said I could breastfeed. The World Health Organization said I could breastfeed if I took my antiretrovirals. So why would Canada disagree with that?
I'm glad you did your research. WHO recommends exclusive breastfeeding for low-income countries where the water is not safe enough to make formula with. Therefore, the benefits outweigh the risks in these countries where infection is rampant. In Alberta, we have the resources to support formula feeding, and we even offer free formula for the first year after birth if you're a mom with HIV. In this case, the risks outweigh the benefits of breastfeeding.
This was not the advice we wanted. We'll just keep it between us that you're breastfeeding. I'm sure it's fine if we don't tell anybody.
Well, my job is to help support and provide you with enough information to make an informed decision. I don't mean to scare you, but I think it's important to know that according to the HIV/AIDS legal network, you could be threatened with criminal charges if you're caught breastfeeding your baby, risking the transmission of HIV.
I just want to be part of this experience too, and I don't want us to be an embarrassment to our community.
Maya, you can be part of this experience too. You can assist your daughter by preparing the formula, and you can even feed your grandchild. As for the community, there are things you can say that will explain your situation without revealing your daughter has HIV.
You can lie if you want, Mom. Just let me formula feed.
But what are we going to say when people ask?
You know, Anna, this is a common problem for women who think they'll be criticized for not breastfeeding. Some women find it helpful to create a cover story such as saying you have an infection or you're not producing enough breast milk.
I understand that, but I have no idea how to formula feed or even how to make formula. What's in it anyways?
So in terms of formula, you have many different options. In general, formula contains all the nutritive benefits necessary for your baby's growth and development. Some examples are powder formulas where you mix the powder with water, or there's ready-to-feed formulas. Canada recommends ready-to-feed formula as it requires minimal preparation because you don't add water to it, and in turn has a lower risk of contamination. Compared to powder formula, there are specific steps you need to take, such as sterilizing equipment and making sure your water is clean to prevent the transmission of bacteria. If you're not at home, ready-to-feed formula is also the most convenient option for moms to use.
Thanks. I get why I can't breastfeed now, even if I am taking my meds. I'll come to you and Kathy if I have any more questions.
And I'll work on coming to terms with her not breastfeeding. I just want to protect my daughter and my grandbaby.
And before you leave today, I can make sure you're referred to the Southern Alberta HIV program at the Sheldon Schumer Clinic, and I can also teach you more about formula feeding and properly bottle feeding. Do you have any more questions for me today?
No, I'm okay.
Okay, we'll keep in contact then.